Go.
Hi, I'm Judith Kent. I'm a student nurse from South Central College, and I'm practicing health assessments. It is now 7 o'clock in the morning. I've just come on shift, and I have a new patient. He's 55 years old. He's a male. He came into ER last night with pneumonia, a temperature of 103.5, complaining of shortness of breath, and he was given Tylenol in the ER. And now 6 o'clock assessment was his blood pressure was 140/90, pulse was 100, respirations were 30, and his O2 saturation was 91%. So now I'm going to go see him. Hello, how are you?
Good.
Good. I'm Judith Kent. I'm a student nurse from South Central College in North Mankato, and I'm going to be your nurse today, and I came to check on you.
Okay.
Can you tell me your name?
Wallace Wiggins,
Oh, okay. And your birthday?
February 1, 1959.
Okay. Okay, good. Thank you. So you came into ER last night. You had a high fever. Is that correct?
Yes.
Okay. Can you tell me why you came in then? Besides the fever?
Yeah, I had fever, high fever, and I had coughing, and then, and I came to the
Okay.
emergency
And they
room.
said that you had shortness of breath?
Yes.
Yes?
Yeah, I can't breathe that time.
Very well.
Yeah.
Okay.
Yeah.
How are you breathing right now?
Yeah, still
Still?
have
Would you
hard time.
Would you like to sit up a little higher?
Yes.
Would you think that would help your breathing?
Yes.
Okay.
Helping me.
And so that just coming up higher helps a lot. Laying down, does that make it worse?
Yes.
Your breathing? Okay.
Yeah.
Okay. And what medications do you take?
Multivitamin.
Okay. Anything else?
Nothing.
Nothing else?
Yes.
And do you have any allergies?
No, that I know.
Oh, okay. Good. Good. And so you have this breathing problem last night and high fever, and they said it was pneumonia. Have you had this before?
No.
No? No
Yeah.
breathing problems like this?
No.
Okay. Does anyone in your family have any breathing problems?
I don't remember.
Okay. All right. So nobody has has had to come to the hospital for pneumonia in your family?
I don't know the name, but yeah.
But they had some breathing
some
problems?
yeah.
Oh, okay. Okay. But I saw that you're a smoker? Is that right?
Yes.
Okay.
I smoke every day.
Every day. How long have you been smoking?
For 10 years.
10 years. Okay.
Yeah.
And how much do you smoke?
About one packet.
One pack a day?
Yeah.
Okay. And how do you feel about your smoking?
Yeah, I think even though it's bad for health, but yeah, I don't know how to
Quit?
quit. Yeah.
Okay. Well, would you quit if you had somebody helping you?
Yeah, I would
would
love
try?
to. If
You
it's
want
easy.
to try?
Yeah.
Okay. Well, smoking, if you have lung problems, smoking can irritate your lungs because the cigarette smoke irritates. Okay, when you breathe in, your throat breaks into the bronchial tubes that go into each lung, and those tubes get irritated with the cigarette smoke. And when they're irritated, they produce more phlegm, more mucus. Okay, and then that also brings on inflammation into those tubes that go into your lungs, where your alveoli are, the little sacs where the oxygen exchanges. Okay, so when you have that inflammation in the airways, it hurts the cilia. The cilia are lining the airways. There's little hairs, and these hairs work together and they bring up the mucus. So you haven't been able to cough up too much mucus that's been in your lungs, and that's probably what's contributing to your pneumonia.
Oh.
Okay, when
It
the
could
cigarette
be.
smoke,
Yeah.
so the cilia bring the mucus up. The cigarette smoke eventually, with the inflammation, hurts the cilia, so they can't bring anything up.
Oh.
So when you're coughing and you don't feel like you're bringing anything up, the cigarette smoke probably is irritating that
Oh.
and helping to create a bad situation.
How
But
bad?
but if you can stop smoking for even a week or two while you heal from pneumonia, that would be awesome. And I can ask the doctor if he can send an order for a nicotine patch you can put on your arm and you won't have that urge to smoke for a while. It'll help you get over smoking. And
What is that patch?
It's called a nicotine patch, and it just helps your body to relieve the desire to smoke. So you'll be more content with not smoking.
So I feel like smoking then?
Yeah, you won't feel as much like you need to smoke.
Oh,
Okay.
That's good, I think.
Yeah. Now, let's see. Can I take your vitals?
Okay.
Well, actually, first, why don't you sit up and I'll listen to your lungs, and then we'll work on your vitals. Can you sit up?
Okay.
And I just want to listen to your deep breathing. So if you want to go ahead and just take some deep breaths. Just a second here. Okay, just breathe in and out. Okay. Okay, go ahead. Okay, deep breathe in. Okay, out. And just keep taking a slow deep breath. Good. Okay, good. Keep going in. Okay, go out. Just going to go down a little further here. Okay, keep going. Good job. Okay, keep breathing. Okay. Okay. Okay, and I just want to listen a little bit right here. So can you still take a deep breath? Keep going. Okay. Okay, another deep breath. Okay. Okay, well, I am hearing some crackles in your lungs.
Okay.
Crackles are fluid. When the air is moving in and out of your lungs, it kind of makes the fluid crackle a little bit, and that's what I hear. So that means there's fluid in your lungs, and that's probably contributing to the pneumonia and why you feel short of breath. Okay. Are you breathing okay like that, or do you want to sit up more?
Okay.
You can. There's no problem. Okay, let me take your vitals. I'm going to take your blood pressure.
Okay.
And I also want to ask about your pain level. Now, at 6 o'clock, they said you reported a pain level of 6 out of 0 to 10, where 0 is no pain at all, 10 is the most that you could possibly bear, and you said your pain level was 6 from your breathing. What would you say it is now? About the same? Okay. All right. Okay, I want to take your blood pressure first. And this will only be tight for a little bit.
Okay.
You can just rest your arm down, that's fine. Okay, here we go. Okay. Well, it's still running a little high. It's running 135 over 85, so it's still a little bit elevated. We'll keep an eye on that. Okay, and then I want to take your temperature. I'm just going to go in your ear. Okay. We're still running a little bit of a temperature of 102.5, so it's still a little elevated. That means your body's fighting off the infection, which is good. Okay, I'll keep going with this. This is going to see how much oxygen is getting to your tissues. Okay. Okay, well, you're doing a little bit better. That's pretty good. We'll keep an eye on that, and that kind of shows us how your breathing is. The oxygen is going to your tissues and helping your body.
Okay, how much is it?
It was about 92% O2, so that's pretty good. Okay, now I want to listen to your heart again. Let's get up here again. Okay, that's fine. Okay, I'm going to listen here. Okay. Okay, and I just want to take your pulse here on your hand at the same time. And I'm just going to listen for a minute. Okay. All right. Well, your pulse is still pretty elevated. It's about 96, 98 beats per minute. Your respirations are still almost 30 minutes. So that means your body's working pretty hard to get that oxygen into it. Okay? We want to help you feel better and get that pneumonia out of your lungs so that you'll have a better oxygen exchange for your body. Okay? Let's see. And now, since I'm here, would you mind if I just did a quick head-to-toe assessment on you?
Okay.
Okay?
Just
mind?
make it fast.
Make it faster, not feeling very good. Okay. All right. Let's see. So, you said you kind of, did you say you had a cold or you had some coughing leading up to you feeling sick and coming into the ER?
Yes.
Okay. And let's see. How's your vision? You move your
Yes.
You're feeling a little sleepy? Okay. And your ears? You have any problems with your hearing?
No.
No? Okay. And nose? Can you stick out your tongue and say ah? Have you had any throat problems?
No.
Okay. No sore throat? Okay, well that's good. Does any of this hurt?
No.
Okay, I'm just going to feel your throat here. Okay. Can you swallow for me? Okay, and that doesn't hurt? Okay. You have a little swelling in your glands, so it looks like you did have a little infection, upper respiratory infection at some point, maybe to bring this all on.
Yeah.
Okay, I'm going to just, yeah, I'm going to just pinch your skin a little bit. And this is to see if you're becoming dehydrated. It looks like you are a little bit, because you had the high fever, and you still do, and it's throwing off a lot of moisture from your body. And also when you're doing the rapid breathing, you know, to try to get enough oxygen when you're short of breath, that also throws off a lot of fluid or moisture from your body. So I think what would help you today is if you can drink as many fluids as you can, like ice water, juice. I can ask the CNA to bring you some hot tea, hot broth, something like that.
Can I get coffee?
Well, coffee is a diuretic, and that means that it'll make you go to the bathroom more. So you may be drinking your coffee orally, but then your body's processing it and making you go to the bathroom, so then it just comes back out. So you're not getting the fluid to your tissues, which is what you need to do to help this, because you're getting a little dehydrated, a little low. Okay? And let's see, let's see, your IV looks pretty good. And we'll just leave that there and see if the doctor may want to give you some IV fluids too, in addition to what you can drink today, just so you don't get dehydrated. Okay, let's see now. And I'll also test your capillary refill. This is how quickly your nails turn pink again after I pinch it. That means that how well the blood is flowing to your fingers. So that looks pretty good. Let's see, your skin looks good. Do you have any skin problems? I didn't see anything on your back. No? No sores or anything like that? No? Okay. Would you mind if I just take a peek at your stomach? Okay. And can I put your head down just a little bit? I know you're having some trouble breathing. Or just to get a good look at your stomach. Okay. Have you been having any problems having a bowel movement?
No.
No? Okay, good. Do you go every day?
Every day, yeah.
Okay, good. That's good. Okay. Mind if I just listen? And this will just take a few minutes.
Okay.
Okay. Well, I don't hear a lot of movement in your stomach. Have you been eating as much as usual when you've not been feeling well?
Not
It's
much.
kind of cutting down a little bit,
Yeah.
so that's probably what it is. Oh, but you say you go to the bathroom every day, so that's
Yes,
good. But I'm
yes.
just going to press a little on your stomach, and you just tell me if it hurts, okay?
No.
Nothing there? Okay, here?
No.
No? Nothing? Good. Here?
No.
Okay. Here?
No.
Okay, good. All right, thank you. And what about urinating? Do you have any trouble urinating? Going to pee?
No.
No?
Okay, yeah.
Okay. When you start going, do you have any hesitation? Do you have to wait to start going at all?
No.
Okay.
I don't have any problem there.
No problem. Okay,
Yeah.
good. And have you had a prostate exam
Yes.
from your doctor?
Yes.
Okay, every year? Okay,
Yes.
good. Very good.
Mm.
Okay, and then I just want to look at your joints and how your movement is. Do
Okay.
you have any pain when you move your shoulder? No pain?
No.
Okay, and flex okay?
Yeah.
Okay, why don't you press against my hand? Okay, and pull. Okay, and then I want you to squeeze my hands. Okay, good. All right, and then let me look at your legs.
Okay.
Now, do you have any problems walking or any pain when you're walking?
No.
No? No knee problems, foot problems? No? Okay, here, I'll just look at your feet and your legs. I just want to lift up your leg a little bit. So you can bend your knee, no problem? No hip problem?
No.
No? Okay. And this one? Nothing? Okay, good. Good. Okay, let's see. Can you press against my hands? Okay. Can you pull back against my hands? Okay. And can you pull in? Okay. And push out? Okay. Okay. And I want to listen, I want to feel for your pulse in your feet here.
Okay.
Okay, good. It feels even and good. Okay. And I want to check for the same thing I did on your finger. I want to see if you how your circulation is to your feet.
Okay.
Okay. And can you feel my touch? All the way
Yes.
down? No problems?
No.
Okay. Awesome. All right then.
I just have hard time with this.
Just okay. Let me put your head up. You can. How far do you want to go?
That's
Is that good? Okay.
That's good.
Okay. You feel like you can rest good that way. Okay. Good. All right. Well, I'm going to, let's see, I'm going to have the CNA bring you fluids, ice water. You tell her or him what kind of juice you like to drink,
Okay.
or hot broth or hot tea. Okay. And oh yes,
My
this
breakfast.
your breakfast. Oh yes, you can ask them about breakfast too.
Okay.
Okay. I'm going to call your doctor and ask about if he wants to give you a nicotine patch so you don't have to smoke while you're in the hospital and while you're healing from pneumonia.
Okay.
Let's see, if he has some medications for your pain. You said you still have a pain level of 6 out of 10. Remember that pain scale? Okay. And so we want your pain level to come down so that you're comfortable breathing,
Okay.
you know. And I'll have the CNA come by and try to get you up to walk a little bit, and that movement will help you cough up that phlegm. Remember that the cilia from smoking aren't able to bring that phlegm up.
Okay.
So everything you do to bring the phlegm up and cough up will be excellent.
Okay.
So then I'll also ask the doctor if he wants to do any tests to see what kind of bug you have, bacteria or virus, and if he wants to give you any medications for that,
Okay.
and maybe any IV fluids to help you rehydrate after you've been sick. Okay?
Good.
And I also have one more thing for you. The AR sent this out for you to use, the AR doctor. Have you ever seen one before?
Yeah, but I don't have this.
Okay, it's called the incentive spirometer.
Okay.
What you do is you breathe in here, you make the blue disc go up,
Okay.
and that'll show you how deep you're breathing and how much air you're able to push out.
Okay.
Okay, you want to try it now? Okay, let's blow it out. Okay, and it goes way up, way up, way up. Okay, very good, very good, good. So this will help you breathe deep, and that'll also help bring up that mucus that's deep in
Okay.
your lungs, where here the crackles down low in your back.
Mm-hmm.
Okay, so if you can do this like a few times every half hour or every hour, that would be really good.
Okay.
Okay, so I will come back and check on you
Okay.
and see how you're doing. And I'll send the CNA in to help you with those things we mentioned.
Okay.
Okay?
Thank you.
All right, thank you. Right now. Okay. A situation we have here is we have a 55-year-old male who came into the ER last night with pneumonia, a high temperature of 103.5, and complaining of shortness of breath at that time. And now he's on my nursing floor. He was been sick for the last few days. He was kind of vague on remembering just what exactly brought this on. He has not had any breathing problems before, doesn't have any history of it in his family, but he's still feeling short of breath. His pain level is 6 out of 10 yet, so he's got chest pain. His fever is still pretty high, 102.5. Respiration's almost 30 still, and the heartbeat is still pretty high. His O2 saturation, though, is like 91, 92%, so that's good. I'm going to call the doctor. Well, I'm going to get the CNA to bring some fluids for him and help him get up and walk later. I'm going to call the doctor and see if the doctor can bring him a nicotine, or send an order for a nicotine patch so he won't need to smoke while he's in the hospital and healing. And also maybe some IV fluids so he doesn't get dehydrated, or can, in addition to what he's going to drink today. And let's see. Pain medication, IV fluids, and see if the doctor wants to run any tests for him to see just what kind of bacteria or virus this is causing, and see if the doctor wants to give him some antibiotics or other medication to help. Thank you.